Good morning, everybody. It is stormy and raining, has been all night, and more coming for the weekend. So, if you are on a bunch of medications, do you ever feel like your job is to take your medications? Depending, my dad, before he died, was on 15 meds, and he spent most of his day trying to figure out, what time his next medication dose was, so much so that he kind of forgot to eat sometimes. So wouldn't it be better to just avoid all that nonsense in the first place? And there's ways to do that, and functional medicine prevent chronic illness in the first place, or if you already have a chronic disease problem, including cancer, make it easier for your doctor to manage that disease and potentially even reverse it altogether. So that's the point of working with a physician and a functional medicine health coach, or a functional medicine physician in the first, even all alone. They tend to spend more time and delve into the root causes of what causes chronic disease. So basically, what's the role of functional medicine to prevent the multiple diseases that may start with one? So let's say diabetes, which has a whole lot of comorbidities, kind of like addiction. 58% of people that are opiate addicts have a comorbidity, usually a psychological one. But quite a few chronic diseases, heart disease, diabetes, even cancer, have several different root causes that decades there's been a sharp rise in the incidence of several lifestyle disorders. So diabetes, hypertension, heart attacks, and stroke. And the number of people that live with two or more chronic conditions increases all the time. So we have been on this fight to avoid chronic conditions and chronic disease, specifically obesity, diabetes, insulin resistance, and heart disease. So things are just not working like we think. Okay. So I'm trying to figure out my key frame rate. That seems to be the reason. Death. And that's why I'm having a little bit of trouble with my little classes kind of starting and stopping. So hopefully this one is going to be okay. We'll see. And if not, I'll do it again. So functional medicine is aimed at trying to figure out these comorbidities. So you need to understand the pathogenesis, or the reason and cause that underlies the development of chronic disease and the comorbid conditions, so you can avoid all that together. So causative factors to chronic disease and comorbidities are usually inflammation, infections, immune dysregulation, toxic exposures, gut problems, nutritional deficiency. So your body's designed to do that. And that may or may not already present as a chronic disease. However, when we don't address those factors, it can create a cascade effect, and that's when one chronic disease can turn into another. So with functional medicine and health coaching, we're trying to provide strategies to overcome the risk of multiple problems by eliminating, after identification, the root cause that's causing the problem. So what are comorbidities? So that's the development of more than one chronic disorder that has common causes and similar pathogenesis. So it's created from a similar root cause because of the similarities of the risk factors. And they're more likely to affect people that have diabetes and high cholesterol, hypertension, chronic Alzheimer's disease, childhood asthma, on and on and on. So what's the implication of those? So chronic diseases like to cluster together and hang out due to the shared risk factors. Okay, so inflammation, oxidative stress, toxin exposure, unhealthy lifestyle, and nutritional deficiencies. So you get recurrent hospitalizations, poor quality of life, increased health care costs, and even premature death. So looking at root causes can reduce all of that. Okay, they also drive poor outcomes in patients with cancer and chronic kidney diseases and stroke and heart disease. So comorbidities make all those worse. So delving down into the root, similar cause structure can help alleviate, if not eliminate, some of those chronic comorbidities and chronic disease. So again, most chronic disease have similar causation factors, meaning that the presence of one risk factor may put you at risk for developing multiple diseases. And then you get to do what my dad did and take 15 meds and spend most of your day taking pills, etc., etc. So you're triggering comorbidities with the patient developing multiple chronic diseases. Okay, so most healthcare practicing at this point, and has developed over my career, is symptom-based medicine. And what we're after in functional medicine and functional medicine health coaching is cause-based medicine. So individualized approaches to the root causes that cause chronic disease and comorbidities. Okay, so the risk factors underlying most chronic disease. First is inflammation. It's the root of many diseases. It can help trigger the development of chronic disease like diabetes and obesity, autoimmune disorders, arthritis, even Parkinson's and Alzheimer's disease. And so eliminating or manipulating inflammation to suppress it involves agents that are over the counter: curcumin, turmeric, producing factors like eating foods to which you're intolerant. There's a hair test that will tell you not only your food allergies, but more importantly, what you're intolerant to in your gut. Every person is different. You have different DNA. Your genetics are different. So wouldn't it be nice to know which foods that you're intolerant to so that you can avoid them for the most part? And then second risk factor, immune dysregulation. We've seen that in the past year or so. So a weak or abnormally functioning immune system reduces the efficiency of your body being able to defend itself and protect itself against disease-causing agents like bacteria and viruses. It can deprive the body of its ability to risk the development of acute and chronic diseases, including chronic infection and autoimmune disorders and cancer. Okay, you fight off cancer multiple times during your life. Good morning, Eileen. Hey, Tammy. I hope I'm not stopping and starting. And things have changed on Facebook Live. We've got a new dashboard. Everything's different. So there's some setting that might be wrong that I haven't figured out yet. I think I've got my audio figured out. So strengthening your immune system is kind of a deal. Cancer patients fight off, well, before you develop a cancer that actually sets in place and starts feeding and growing, your immune system, if it's healthy, will fight off the development of cancer cells. I was taught years ago that most people develop cancer cells about 7 times before a cancer actually takes root and starts causing trouble. So strengthening your immune system, especially during the last year and a half, involves improving your intake of essential nutrients, so zinc, vitamin D, and vitamin C. Okay. In addition to mushrooms, there's probiotics, there's herbs, there's ginseng. Regular exercise can help you improve your immune system and help you fight off disease-causing agents like cancer. And even if you already have cancer, if you delve into the root cause of what is feeding and allowing your cancer to grow, you can potentially manipulate the response of cancer to whatever treatment you're undergoing. So we're not saying instead of treatment for cancer. We're talking about in addition to eliminating root causes that are feeding your cancer cells. So that whatever your doctor's doing may actually work or work better. Okay, third risk factor, toxins. So exposure to toxins like additives and preservatives in foods, so pay attention to your food labels, chemicals and cosmetics, pollutants in the air, heavy metals, or you have mercury amalgam, maybe you should get those removed and replaced with better fillings. And then mobile towers, that's a big fight, or cell phone towers causing trouble. Well, we're at 5G now, so there's quite a bit stronger signal passing through you, just like radio waves and radon coming out of the ground and around your house. So it puts you at, exposure to toxins puts you at risk of several comorbidities. So skin diseases, allergies, COPD, chronic obstructive pulmonary disease, and the host of problems that causes, inflammatory bowel disease, depression, ADHD, metabolic syndrome, anxiety, cancer, lots more, diabetes, obesity, insulin resistance, leading great way to protect vital organs against toxicity of those toxins. And remember, most stuff, the thing that cleans your, the excretory organ that's most important is your liver. So anything that goes in your mouth goes through your liver biochemically. So adopting natural detox methods can help eliminate toxins and prevent their buildup in healthy tissues. And if you're avoiding all that and you have cancer and you're working on these other risk factors, maybe you got a good shot at beating whatever cancer, or a better shot at beating whatever cancer you're fighting. Fourth risk factor, nutritional depletion. So lack of adequate nutrients in the diet can deprive the body of the support it needs for human physiology, the course I teach at State Fair Community College. We talk quite a bit in human physiology since I have a clinical background. My students why health coaching is kind of a big deal, and functional medicine is a big deal. So nutrient depletion alters your gut function, and subsequently you get malabsorption, or you get things in your bloodstream that you don't want in there. So it's important to ensure that your gut is functioning at an optimal level, and it's taking the nutrients present in the food, working them together for the human physiologic factor, which maintains homeostasis of your body, normal function. So you need macronutrients. You do need some carbohydrates, just not the simple and sugary ones. So vegetable and fruit-based carbohydrates, healthy fats and proteins, and then micronutrients including vitamins, minerals, antioxidants, to maintain good health and prevent comorbidities. So when we health coach people, we go through all that and figure out, okay, either by lab analysis or just from an intake history, what's missing. Then lifestyle habits, number 5. So smoking, alcohol intake, lack of physical activities can play a huge role in triggering the development of comorbidities. So lung cancer, alcoholic hepatitis, obesity, diabetes, stroke, and heart attacks. Stress is a huge factor for disease and comorbidities because it's depleting ways to do that. That's over the counter, and that's what we teach as a health coach. And then stress management skills are implemented. Stress and anxiety and depression, huge risk factor for chronic disease development. So you want to adapt a healthy lifestyle. I'm not saying you can't ever eat a piece of cake, because that's not okay. Occasionally you need a piece of cake, right? Or a piece of pie. Wouldn't recommend candy, but so eating a nutritious diet, and we help you figure that out. what you're eating that may not be helpful for you, and then regular exercise. And we're not talking about running the Boston Marathon, and I'm not talking about bench pressing 350 pounds. I'm talking about walking. Your 10,000 steps, your phone will measure them, is the goal. 10,000 steps a day for you to be physically active. So what's the role of functional medicine in helping manage? So functional medicine is aimed at understanding and identifying critical physiologic factors. How is your body maintaining homeostasis? And if it's not, how can we reverse that and get at the underlying cause of the development of chronic disease, including cancer? So the approach of functional medicine can ripple through your body and address the development of multiple diseases. So being aware of common risk factors shared by chronic disease, the 5 that we just went through, and actually there's 6 or 7 if you are paying attention. There's more than 5. So that allows people to adopt healthier strategies to avoid comorbidities, to avoid the root causes that lead to chronic disease, in which case of your time taking your medications and going to your doctor follow-up visits, okay? And so if you manage these risk factors, you can protect yourself from several illnesses and improve your overall health. So pretty much comorbidities, just to recap, commonly associated with more complex clinical management, multiple meds, lots of this, lots of that, worse health outcomes, lower quality of life. Wouldn't it be nice to live to be 90 and be able to do whatever you want? For the most part. But I don't mind living to old age, I just don't want to be infirm. And in addressing the key physiologic homeostatic mechanisms that can become dysfunctional by adopting strategies that are recommended by the functional medicine approach, leading to an by delving into these root cause risk factors. Okay, so we educate about functional medicine to those who wish to empower themselves in understanding how to address the root causes and avoid chronic disease development in the first place overall. So I started doing that basically in 2015 while I was practicing, and then dropped medical practice because it was fraught with nobody getting better, basically, to become a health coach with a functional medicine approach. So is there any data, scientific data, behind functional medicine and health coaching? Okay, well, there is. The first one that I read was published October 25th, 2019. Through the NIH from Stanford University in 2017. And there's scientific literature going back at least 10 years on functional medicine health coaching, but just lifestyle and health coaching in general. So health coaching is considered by some, including Harvard University, to be the fastest growing and most important area in healthcare. So you can work with a functional medicine doctor, or you can work in concert with your provider, whether that be a doctor or a physician's assistant or a nurse practitioner, if they're open to help from a health coach. Most health coaching is either done in a group setting or one-on-one online. So it's internet-based or it's telephonic-based health coaching. Most of the people I work with, I talk to all the time, usually by text. I hear from several every day, things that we need to work on or things that we need to fix. And then collaborating with physicians, anybody that needs prescriptive medicines, that can happen. So this article from the Cleveland Clinic was basically talking about it's called the Association of the functional medicine model of care with patient-reported health-related quality of life outcomes, October 25th, 2019, in the JAMA Network, Journal of the American Medical Association. 7,252 patients, working with health coaches, nurses, a team-oriented approach, including the hierarchy of the physician or the health provider, to reverse illness, promote health, and optimize physiologic function. Okay, so they found a health care-related quality of life improvement with that model. These were adults 18 years of age or older, and they did this study between April 1st, 2015 and March 1st, 2017, and reported it in 2019. The Stanford study is called Clinical Effectiveness of Lifestyle Health Coaching. So the Cleveland Clinic model was a little bit more in-depth. But same thing, they've got a very well, that took them 10 years to work on this program at Stanford with great results. I could read you the whole thing, but I'm not going to do it because, like most scientific literature, it's got lots of jargon in it, etc. So I'm basically giving you the highlights of these, and so maybe we'll get down to the conclusion. So there's clinical, they go through clinical effectiveness, they've got tables. We've developed a tested, successful implementation of an affordable, evidence-based, technology-enabled, data-driven, outcomes-oriented, comprehensive lifestyle health coach program. This one was done in large companies of 3,000 or more employees, so they implemented this for large corporations. And corporations, corporate America is starting to look quite a bit at lifestyle and health coaching, not just necessarily health coaching, but coaching as far as career coaching, all kinds of coaching. So it's an important component of the armamentarium of interventions that can be used in the global war against potentially preventable and non-communicable chronic diseases. And of course, if you improve your immune system, perhaps you won't even have a communicable disease overall. And then from Harvard, there's a physician named Peter Grinspoon, April of 2020, and they started the hospital he works at. I'm not quite sure. This is Harvard Health Publishing. And so that the hospital in fall of 2019 put Okay, so really a key component of coaching is motivational interviewing and open-ended questions, which is kind of the whole point of an intake history. So you ask open-ended questions to help a person elicit his or her own reasons for change in their health. So in other words, instead of a doctor saying you need to lose weight, and I knew my doctor in Midwest City was notorious for that. She thought everybody was fat. You need to lose weight. A health coach might ask, how might your life be different if you lost the weight that you've been trying to lose? And that's most of what I do, is weight control. And if we can control the weight, then we can delve into other issues. And then once the weight is lost, maintaining it, that's a biggie. Well, there's strategies to lose weight and then strategies to maintain weight, and that takes some work. You've got to delve into it. So positive psychology, that's a cornerstone of coaching. So you don't focus on what's wrong with people and what needs to be fixed. That's allopathic medicine and why I quit practicing. So coaching philosophy focuses on what has, can, and will work better for you. So instead of rooting around for problems to dwell on, a coach works with you to harness your strengths in order to improve the health behaviors you want to address. So that's kind of how it goes. Good morning, Tammy. So I'm glad you're on this. I work with Tammy. If you're watching this and you're in the comments, Tammy is a nutrition coach, functional as often as we can. So it's a team-oriented approach, and again, you're focusing on positivity. What are your strengths? How can we use those strengths to manage root causes that may cause chronic illness? How do we get rid of your inflammation? How do we get rid of chronic infections? How do we reverse nutritional deficiencies, reverse inflammation, avoid your toxins, look at your food intolerances, and try to avoid the things that your body just doesn't like when you eat. You know, when you eat certain things, you get bloated. It happened to me yesterday, and I had cooked tandoori chicken the night before, and I'm not exactly sure if that was it, but I was kind of hurting yesterday. Didn't take, a couple hours, maybe 3 hours, bloating, all that kind of stuff. And I'm thinking, okay, so is there something in the intestinal lining or my gastrointestinal gut brain not like it? So I'm going to kind of think about that a little bit, try it again, and then, it's a lot of give and take as far as figuring out, okay, what are you intolerant to? You can get your hair analyzed. It's actually pretty inexpensive, like $90. There's a company in the United Kingdom that does it. I've had several people send their hair to Britain, and they get a very nice report back that tells them what their body doesn't like in their gut. So that's handy. So we'll keep teaching. We'll just keep teaching almost everything that I talk about, except that particular little virus problem that I touch on about every 2-3 months, is about health coaching. I teach what a health coach can do for you and what functional medicine can do. Occasional video and audio pauses, captioning continues. So I've got a fool around that says the current frame rate is too high or too low. Please set the frame rate to 15 to 60 frames per second. So I haven't figured that out yet, but I will. And hopefully when we do our next class, I'll have figured out what Facebook Live has done to change the dashboard and all these things that I have to manipulate so you can hear me and I don't just like go away and then come back. Okay, thanks for being here, Eileen, Tammy, 2 Tammys here today. So I'll talk to you. I've got something I might do later this afternoon. I've got a woman that has come up with this hemp infused arthritis formula that's amazing. Shoulder starts acting up, I put this stuff on and it's like gone. So stiffness and pain just goes away. And it's a CBD hemp based, or actually, yeah, CBD based product with herbs, etc., oils that she grows on her farm. So I'm going to do a sort of commercial on that later today. So look out for that. Okay, have a great day. We've got sun right now, but more rain coming, so don't float away and don't cross roads that have water over them. You know that, but people do it all the time. All right, talk to you later today, maybe tomorrow, definitely Monday. See ya. Bye.